are healthcare services? Is it equality there in a healthcare services? Today we will discuss and learn it. In our India, if you look at the situation of health services, private services are increasing very much. That means health care facilities provided by private companies or private individuals are increasing to a great extent. The two, we find these private services, in the sense private health services, are focused at urban area. We find a number of hospitals in urban areas. They focus on urban area. It means there in urban area we find a number of hospitals compared to the rural area. And these private health services are running for profit. They move with a motive that is to increase their profit. So the expenses, that is health expenses in private hospitals, is high compared to the public health hospitals. So many of the rural areas, there is no health facilities properly. We know that many people from rural area, they come to the urban area in search of health facilities. See, we people are going to Hyderabad to get better health services and quality one. That to get expertised doctors services. Further, people move to the Bangalore, Delhi, and other states, other countries in the states in the sense other countries. There they find healthcare services. What about people who are in a rural area? How do they access to the healthcare services? Because everyone should get health facilities. There should not be deviation and inaccessibility towards health facilities in any area, right? So here we look that to provide health services to all, our government is running a 108 and what to call 104 services, right? We have seen many times here that 108 vehicles, right? Those are ambulance, 108 ambulances are moving through the streets, and 104 ambulances also. What is the difference between 108 and 104 ambulance services? 108 services are those which make the victim, that patient, victim in the sense patient, 108 services make the patient to reach a nearby health center. When we ring up to 108, immediately those services will be available to those patient who rang up, and the patient will be taken to the nearby health hospital to get health services. That is 108. Then 104, 104 also one kind of health services given for a rural area. It means regularly at every month, regularly at every month we see some health persons and medicines are given to the patients in rural area. It is that doctors and medicines will be carried regularly every month to the rural area. There will be health checkups periodically, that means at a regular interval in the rural area. That means by 104 ambulances, doctors, and the medicines will be taken to the patient nearby the patient home. There the treatment will is given, that is in rural area. So to provide health services to all, there the government is running 108 and 104 ambulances. Okay. And another important point in getting the medical services, that is only 20 percentage of the population in our India. How much? 20 percentage of the population in India can afford medical expenses when they become ill or sick. It means those are rich people, they are getting the better and quality health services by paying certain lakhs of amount. We know that many people fear to go hospital because of medical expenses, right? All the people are not able to get medical services with a huge amount of money, right? It means everybody cannot access to the health services run by the private sector, that is the private health services, because they run for profit. They charge high expenses, they charge a high amount for the treatment given there. There is a report conducted a survey, and that survey report says in India 40 percentage of the people who admitted in the hospital and who admitted in the hospital due to some illness or injury, they are borrowing money to get the treatment. Understand? 40 percentage of the people, 20 percentage of the people, sorry, 20 percentage of the population are able to get quality health services which are given at high expenses, and another 40 percentage of the population are borrowing money to get a treatment in hospitals. Some lakhs, understand? Or they may sell their property. Have you heard that some people who admitted into the hospital had sold their property, some 2 3 acres of land, or the building, right, or the jewelry, because they cannot get such a high expensive medical services, right? This is the situation we look, we find and face in India. Okay, everywhere it is there. It means 40 percentage of the people who are somewhat rich, they are borrowing money to recover from their illness and injury, right? Because they are also not able to get the health services. Then think that how it will be for poor, a poor family who are not able to get sufficient food daily. How do they get medical services given by the private? In a poor family, if everybody or every illness, if for every kind of health problem, there will be great stress, anxiety, distress on them, because it is a very big burden to them, right? So they move with a lot of distress. Understand? Once if they fell illness, if they suffer with a health problem, that would be great trouble to them, because they have to borrow money. Who will give money to them? Those who are poor, they cannot show some surety, right? In such a poor family, if the illness repeats, it's not one time, second, third, fourth time. If they suffer with the illness, or in a in that family, all the persons, if they suffer with a illness, how would be to them? How do they face it? Understand? So they move with a great distress, anxiety, right? Most of the people in India are poor. Just 20 percentage of the population are rich. Near about 80 percentage approximately we find poor or middle. They cannot afford such a health services. Understand? In many of the poor families, the income is very less. They cannot access to the basic necessities, that is drinking water, then adequate housing. They do not have proper house. Their surroundings may not be clean. So as they do not get safe drinking water and the surroundings are unclean, they fall ill very much. Means many times they may fall ill, right? Who are falling to ill? Poor people. Understand? In these poor families, whatever they earn, that is not enough to get sufficient food, that is nutritious food. They do not eat as much as they should. That means nutritious food is not taken in these poor families. Hence, we call them undernourished. What do you mean by undernourished? Huh? Undernourished in the sense they are not taken nutritious food. So those who do not take nutritious food, their health is very weak. Their immunity power will be low. They fall ill many times, right? So the expenses on the illness also we find very high. They cannot get these private health services, right? If their health problem is very severe one, then they should what to call they should sell off their positions. What in by positions? It may be their property, right? It may be their jewelry, or it may be their land. Understand? Because those are poor, they cannot get it. Understand? So taking an ill person to the hospital also is losing the wages, because along with the patient, one more person is needed to serve him, right? It may be uncle, auntie, brother, okay, or sister. Someone will be accompanied with the patient. So the person who is accompanied to the patient will lose wages. Even the patient also who is working somewhere, he will lose the wages. Understand? So this may be for 1 day, 2 day, or for many days. So in this system of health services, how can we provide better health services to the people? Understand? So we know that many of the health issues are related to the drinking water. Water is very essential for our life and good health, right? If we do not take safe drinking water, then we will be more likely to illness. When there is access to safe drinking water, then many of the diseases can be prevented. Do you know that many of the diseases are water related diseases, right? In India, we see that a large number of cases of diseases are due to lack of clean water, that is safe drinking water. When they are exposed to unsafe unsafe drinking water, then they suffer with diarrhea, dysentery, cholera. That a survey conducted, and that survey given the report, in India every year out over 1600 Indians, every year over 1600 Indians, most of the children who are below 5 years of age are dying because of unsafe drinking water. Instead, it is stated that most of the out of 1600 Indians who die every year, in that most of the deaths are related to children who are below 5 years of age. See, over 1600 Indians who die every year, most of them children who are below 5 years of age. That is every day. How they are dying because of water related diseases. That means it is a clear cut evidence to get an awareness that many of the deaths in India are due to unsafe drinking water. So, if we provide safe drinking water, it can prevent many of the water related diseases because most of the diseases come with unsafe drinking water that we have seen instead, right? Like water, there are other essential facilities needed to all, right? That is healthcare. Just now we discussed the public healthcare facilities and private healthcare facilities. Private healthcare facilities are in cities and towns. There, rich people, that is 20 percentage of the population, can get it, right? So what about the 80 percentage of the population, right? So for them, the government have established hospitals in rural area at village level. We have seen primary health care centers, sub centers, primary health care centers. Then at a divisional level, one health center, community health center. At a district level, we see one hospital, right? Like this, there is a kind of health services from village to towns are running under the control and guidance of the government. In addition to that, 104, 108 services also provided. Anganwadi centers are also providing a nutritious food to the children and pregnant women, lactating mothers. The children who are in Anganwadi, they are observed, right? In this way, we see health care facilities are provided. So, like water, there are other essential facilities to be provided for everyone. That is health care, hmm, sanitation, electricity, public transport, schools. All these are essential facilities required for everyone. So these all are we call public facilities. Once these are established or provided, it will give benefits to many of the people. For example, once a school or hospital is established, it enables many of the people to get health services. If we, in our example, if we take the school, then many of the children can get education in that school, right? If one government school is there, then we find number of children of that locality can get education every year. So once we provide these facilities, it gives benefits to for many people for many years. It can be used for many years for many people. Understand? In the same manner, if electricity is given, then the farmers can run their pump sets to provide irrigation to their fields, that is agriculture fields. And some, we see that some small workshops, that is flour mills, they can run their shops on the electricity, right? That we see, understand? So once these are provided, it can be used by many one. So factories can use this electricity running the machines. Students will find easy to study once the electricity is given to that area in the night time. So in this way, we see that these should be provided by someone. That means at a free of cost or at a low cost, this should be given to all. Then who will come forward to give all these facilities at a low cost for all people? Who will be that someone? That is government. Understand? Public facilities are given to people to provide services. The aim of the public services is to meet the needs of the people. There won't be profit as a aim in public facilities. Whereas the private healthcare services, their aim is what is that? Profit. Government hospitals, that is, which are running by the government, what we call public facilities, are important. Services which are given to all at least cost or free of cost instead. So here the government is one position. It one of the most important function of the government to make sure the public facilities provided must be available to everyone. Okay, public facilities provided by the government should be available to everyone. These public facilities are provided. Private cannot operate these public facilities because their goal is profit. So who will come forward? It is government. So government has to provide these facilities to meet the needs of the people. So in the next class we'll see how the government is bearing the responsibility of providing healthcare services to